Hello, everyone. I'm Dr. Renee Mehrra, and welcome to my show, Renee Report, all over on TV Asia and social media and many other platforms. And today we're talking to one of the world's leading urologists. He's also an oncologist and a principal investigator. He's the chair of the Department of Urology at the Icahn School of Medicine, Mount Sinai system, which is located in New York City. And he is none other than Dr. Ash Tewari, who's on Who's Who list on the top best doctors of America. And it's really a privilege to have him back on my show. We had him a couple of years ago, and he's a wealth of information on many urological concerns as well as uro-oncological concerns. So we're going to talk to Dr. Ash Tewari today. Thank you so much for joining us. I know you have a very, very tight schedule, but we're going to grab you for some time today for a Renee Report. So tell us, the COVID-19, it's consumed all our lives. It's a pandemic, unprecedented. We're living in historic times. What's the latest on COVID-19? I know that in New York, we're flattening the curve, so that's some good news. Your take on this?
Thank you, Renee, for having me on this show. And thanks for bringing up this important topic about COVID-19. COVID-19 is a pandemic of an unbelievable scale. We didn't expect it. World was not prepared for this, but we got hit. And I must say, New York was the epicenter, and at Sinai, we were at the epicenter of the epicenter dealing with this. And what happened in the last couple of months is a true example of how humans deal with an circumstance of this kind and come out strong. A lot of people in different scales, different parts of the life, worked a lot in fighting this pandemic, and good work has come out of it. Unfortunately, we couldn't help everyone, but a lot of the patients, a lot of people got a help. So the medical community and the researchers and everyone combined has some positive stories to share. And that may be the theme of our discussion today, that what we have learned, what we can do, and where will it go from here. So yes, there is a positive ray of hope ahead for our patients who are going to deal with this COVID-19 situation.
Do you feel there's going to be, we're prepared for the second wave if there is a second wave?
Yeah, I mean, I think there will be second wave. There will be more infections coming to the different parts of United States and the world where people have not dealt with it. And that's the reason what we learned in the first round, right here in the city, maybe a good kind of an helping mechanism for those who are going to deal with it. So yes, I agree that there will be more infections coming, but hopefully they will be milder. Hopefully they will have a better control on the things because it will not catch us with a surprise.
So what are the new drugs? I mean, I don't know if there's going to be a universal vaccine because, you know, the virus keeps on mutating, duplicating, has different colors. Even if somebody has antibodies, once they tested positive and now they're negative, what new drugs are there and how effective are they going to be?
So there are many new drugs which are coming up, starting from convalescent plasma to remdesivir and the vaccines which are in the pipeline. There are many vaccines which are being developed by experts in different parts of the world, including the pharmaceutical company. And I'm pretty hopeful that there will be a successful vaccine, maybe more than one in next 6 to 12 months. I think the future holds a bright news for us in terms of the vaccination and all those things. As regards the antibody testing and as regards what happens to a patient who has already been impacted, people have a lot of different points of view. No one is really sure about what's going to happen, but the mutation rates, as we have seen, are still amenable for developing a vaccine. There are certain more virulent kind of mutations have been observed recently, but they are more virulent, more infective, but not more lethal. So while more people can get it, but the severity of disease may not be as bad. So in nutshell, I'm pretty hopeful that there will be a vaccine and it will save many of the people in next 6 months, 12 months. No one knows when exactly, but a lot of hope is out there.
As a principal investigator, you conduct many clinical trials at Mount Sinai. Is there anything happening at this time in terms of clinical trials, and what has been the result so far?
So Mount Sinai has been in the center of the research what has happened in this COVID-19 fight. We not only did fight it within clinical tools, but we went deep into understanding of this pandemic. One of the things we understood was that the spike proteins, which are the hallmark of this virus, actually goes and interact with an enzyme or a receptor on the wall of a cell that is known as ACE2. And ACE2 somehow interacts with an androgen pathway. So there is some explanation as to why men, adult men, are more likely to get into trouble because of COVID-19 infection. And they may have a role to play because of the testosterone axis. So that research is emerging out of many labs, including the people in our own institution. We have co-authored at least 3 different articles looking at what are the different pathways we can use to knock down that pathway of ACE2 versus TempraSerg pathway for testosterone versus COVID interaction. And that potentially can reduce the risk of infection. We are also looking at certain intranasal medicines which can boost up the interferon levels in the nose, and that may have a better fight with the virus first time when it comes into the nasopharynx before it goes to the lungs. The convalescent plasma, Mount Sinai was an important part of that entire discovery. The best antibody testing and the best COVID testing, we have a lab which is doing a lot of work. So I'm very happy with the progress on the research front made at the Mount Sinai and in our own lab, looking at different gender-specific issues which we are dealing in, why men and maybe men with prostate cancer may have a little bit more watch out to be for COVID-19 infection.
And we know that you also went through COVID-19, and you're of course a warrior. Share your personal narrative on this.
So I think the only reason to share that narrative is that as a doctor, I went through that journey and I was amongst the lucky ones who came out of it. And I came out of it because a lot of good treatment I got from the physicians here, very timely, very appropriate, very precise, very on the mark. A lot of best wishes, a lot of friends and family, but partly I think I may have contributed a little bit of a narrative by actions which me, myself could have taken. So I know that if 100 people are going to get this virus, about 80 will not end up in the hospital. 20 will end up in the hospital, and maybe 10 of those 20 will end up in an ICU or the ventilators, and some of them we don't win. So my whole goal here is if I can turn those last 10%, 2 of them into who made it out of ICU by giving them a ray of hope, which I think adds to the value of what a person can do. So we don't have a control on what hits us, but we do have a control on how we respond to what hits us. And as hopeless as situation may look like, there are few things we can do as an individual while going through that. I used to make a list of things which were working for me. If my temperature was 102 instead of 103, I will say this is a victory number 1. My temperature is lower. My pulse ox, if it was 1 point better, I will make a note of that thing. I will do everything possible to keep my lungs intact. I was working with that intensive respiratometer as much as I could, keeping the hope intact. And I think all of that combined and coming out of the ICU and then still continuing to walk and breathe and exercise and walk and breathe and exercise, that led me that in less than 6 weeks, I'm nearly back to normal. I mean, I'm back doing everything which a person does. I walked 10 miles last weekend. So I think keeping the hope intact, doing what we can do, I think is a critical part of this journey. And even at the last moment, don't give up the hope. There are a lot of people waiting for
And
you
as you
outside.
rightly said, I think hope. So maintaining a very positive attitude and boosting up your immune system. And like you said, we have temperature 1 or 2 instead of 1 or 3. So keeping that positive, and balance in you, and at the same time, breathing exercises, boosting your immune system and your whole mental state. I think all this contributes to recovery.
I think it adds 1% gives you an edge. And I would love that edge to be to my friends and family and any other patient who's going through this journey. Don't give up on that last 1%. Just keep trying.
Very important, very important. Especially with this pandemic, as you know, Dr. Tewari, there's another pandemic, which is mental illness that's popped up. People confined to their homes, and it's a lot of issues pop up at that time. And hopefully, it is a temporary one. It's not a chronic clinical depression that continues. So we hope that will subside. But I also wanted to thank all our healthcare personnel and our first responders and essential workers who have been out in the front lines, you included, Dr. Tewari, and helping so many people out there. Sometimes they feel hopeless and helpless and vulnerable. And as a healthcare professional and many other first responders and essential workers who've been really tirelessly committed to bringing about a recovery right here in our city. And so I want to thank you and salute you for that. And I really wish you well that you came out of COVID-19 and you're a story of hope and great success recovery.
Thank you, Renee.
Now, coming to your department, your chair of urology at the Icahn School of Medicine in Mount Sinai health system in New York City, and you being one of the world's leading urologists as well as uro-oncologists, and perform many, many robotic surgery, robotic assisted procedures. I think over 9,000. You're on the top list of who's who doctors. So very seasoned urologist and uro-oncologist. Tell us the impact COVID-19's had on urological issues and uro-oncological issues on your patients.
Thanks, Renee. It's a very important point because on one side, we were dealing with the fear and true problem with the pandemic, and on the other side, there were patients who were waiting on the sideline with a diagnosis of a lethal cancer. So it was very important for us to communicate with the patient so that we can triage. First thing we needed to triage is to risk stratify that patient's likelihood of waiting a little longer for the treatment of the cancer versus getting exposed to in COVID situation. What was the risk benefit? So we came up with the guidelines. We actually wrote a paper on what it implies to the patients who are with the prostate cancer and which patient needs to still treat, which patients can wait, which patient can get into some androgen suppression, which patients can just benefit from the telehealth visits and all those things. So that all has been a Herculean effort between the researchers and the medical community who have been trying to find the best way to triage these patients. Now we are back. Now we are back in normal. We have implemented a very rigorous COVID safe protocol in which we screen for the COVID, we keep an eye on the patients, we do everything possible so that they don't get exposed to. But we still go ahead and treat aggressive cancers. I mean, just last week, we must have treated 20, 30 cases of different kinds, different urological cancers in the department. So we are back and open and almost at the full swing now. And we have created a Midtown and other places where we have a commercial building, which we have converted into a COVID-safe uro cancer area where patient can come safely. We take the temperatures, we make sure that they don't have COVID. The employees are safe, face masks are used, we have social distancing. So it was a tough journey. We managed that by understanding about the COVID, implementing the safety protocols, leveraging our telehealth utilities and capabilities, and now finding the right patient, right treatment, and we are back into the full swing of treating these cancer patients. They
So
can reach out to us and we'll take care of them.
besides emergent surgeries, you have started putting out elective surgeries out in the hospital.
Yeah, that's true. Now we are back being everything normal.
People like a pre-medical condition like a uro-oncological issue, does that make them more susceptible and vulnerable to COVID-19?
I think there is a set group of comorbidities which starts from an age, which starts from obesity, which starts from diabetes, which starts from pulmonary issues, which also continues with the heart issues and the cancer. So all that combined, that increases the impact that individual is going to have it because of the COVID. Social status, the where they live, what kind of a healthcare they have it. Men also have a little bit higher morbidities and likelihood of having trouble with this COVID-19. So all that needs to be factored into when we are screening. And that is the reason they should call an expert when they are dealing with these questions. And we can start the screening with a telehealth visit, which is absolutely safe. Anyone having a smartphone can have an access to us.
So you're right, as social determinants of health, I think they're a very, very important role as to why the patient is going through what they're going through. And, many times we never looked into that, but now I think the healthcare is moving more towards that, especially now with telemedicine and telehealth visits. People will be able to, I think, discuss more of this with the doctor, and then just sitting and, just prescribing medicines. Now, why this patient has to go through all this because of their income status or their,
I think there's a racial disparity. There is a racial disparity in what the outcomes are of prostate cancer that has been magnified within COVID also. So we as a healthcare provider and the health policy, we have to do everything possible to reach out to those who need help.
Yeah.
And we just can make it available to them, a phone number. They can call our offices to get to us, get a telehealth, get it screened, and get themselves tested and get themselves triaged and get the right help they need.
So those patients who needed, radiation or chemotherapy, was that discontinued for a while and had to start it again?
Yeah, that's right. There were some patients who had to delay it, but now we are back giving radiations, doing surgeries, giving chemo. We have created part of the hospitals which are totally COVID safe. So that's the good news.
So what would you recommend to your patients who have urological concerns or uro-oncological concerns? What would be your message in the context of COVID-19, some preventative measures that you would like to give as advice to them?
So while COVID is important, they have to use the face mask. They have to monitor their temperature. They have to do a social distancing. They have to quarantine themselves, but they cannot ignore a cancer. And they need a real expert's help. And expert's help can start with a phone call and a telehealth visit. So at the least, they should not wait, but get a real opinion by an expert on the cancers of different kind. And while being safe at home, taking care of the COVID issues.
So those patients, do like a post follow-up or cystoscopy or cytology for checkup after their chemo or their radiation therapy has been done, and they did not come over because every 3 months or every 6 months. Is that a red flag or something to be concerned about?
Yeah, I think the delaying monitoring or delaying treatment in cancer doesn't impact everyone, but some of the cancers will grow into an incurable stage. But most of the cancers can be delayed for a few months, and we have a whole protocol in place. We have written papers on that.
Do you see a lot of patients with urological issues or uro-oncological issues coming over right now
Yeah, I
to
mean,
the
I think
hospital?
we have a wait time in our clinics to get an appointment and all those things, and we are opening up more. The reason is at any given time we cannot have too many patients in the same space, so we have spaced them out so that there is a social distancing. So we are opening up at longer hours. We are seeing patients early in the day and late in the evening. If needed, we will open up the weekends. I mean, we are doing a lot of virtual visits. So
And do you feel with COVID-19, I think moving forward, a lot of things have changed. I think the healthcare system, the whole landscape is going to change. There will be more virtual meetings and
yeah, that has already happened. Meaning, COVID-19 has challenged the healthcare system in a different way, and I think virtual visit will be an important part of it.
but then again, there would be a balance between a physical exam and a virtual visit. And how would the patient know when they should actually come to see the doctor?
I
Or
think after being screened by a doctor on phone or a telehealth visit, that will be a good starting point. We will know exactly which patient doesn't need to wait. I mean, just come over. We have to see you. We have to examine you.
so, what would be your message to you know, patients out there who have you know, urological concerns? What they should be doing on a regular basis to keep themselves healthy?
The most important thing is don't be fearful. Understand what they are going through. Make a list of the symptoms. Find the best doctors for their disease and reach out. At least talk to them on phone or talk to someone in the team on phone. Get themselves screened. And if needed, go to their offices and get yourself checked. COVID and cancer can go hand in glove, and we have to manage both. We cannot ignore one over the other.
I know that your hospital, your whole health system, health network does a lot of clinical trials also in holistic medicine in Ayurveda as well. Uh, so is it continuing even on, with COVID-19?
So I think those less intense trials have been put on hold, and mostly we are focusing on high-tech cancer trials and COVID trials. So anything which is not going to make an impact, immediate impact, we have put in on hold, and we will slowly start rebounding it. We are getting close to full opening, but it is a phased opening.
I see. Now I know that you use the Da Vinci system for robotic surgeries. Um, has there been any advanced evolving on this in the system, or you know, is it the same that you've been doing for a while?
So the Vinci robotic system is a platform and is evolving in magnification, it's in imaging, its size, and its compactness. So I think combination of image and in compactness is opening up new avenues for the treatment of the cancer. So it is evolving into a much better platform.
I see. So are you performing those surgeries with the new system now?
Yeah, we just did about 7 of them this week.
I see. Well, thank you very much, Dr. Ashutosh Tewari, one of the world's leading urologists and oncologists, uro-oncologist, and chair of the Department of Urology at Icahn School of Medicine, Mount Sinai Health System, located in New York City. And thank you so much for sharing your time and giving us the whole landscape on COVID-19 and urology and uro-oncology, and why is it so important for patients to continue with their visits, and whether it's a tele-visit or whether it's an actual visit, which of course doctors from your hospital can gauge and let them know. But it's important to keep it up so that, you know, early intervention is the key to success and recovery. And so that's an important message that you're giving out, as well as the message of hope that you have brought out on your personal narrative, which is so very important for many, many people who are watching this report, that, you know, whatever may be, as long as you keep your mental condition more positive and optimistic, and keep up your immune system so boosted up, All this really helps with breathing and yoga, and of course, eating the right diet and maintaining a good lifestyle, which adds on to everything that we have talked about. Thank you so much, Dr. Tewari.
Thanks again, Renee, for having me on your show.
Thank you, and thank you for watching Renee Report. I'm Dr. Renee Mehrra.